How does hormonal change affect the health and appearance of vulva?
Oh, good. Well, it can apply to the vagina too. So for the going through the changes of like perimenopause or menopause, meaning like the lack of estrogen. So obviously if we have less estrogen, the tissues are going to be thinner, drier. For the vagina, it can also like just the appearance that usually you have like the rugaes, which are like the little, you can see like, what do you call them?
Ridges.
Ridges, yeah.
Like ridges.
In the vaginal wall, we kind of lose that and it's all like smooth and thinner and drier. On the outside, like the labia minora actually gets a little bit thinner, a little bit smaller. We lose the fat in the labia majora.
And does that happen instantly as soon as you're menopause?
Like that.
Magic.
That's it.
So it takes a bit of time, takes a few months, sometimes a few years for you to notice those symptoms.
Yes.
And what if I'm on hormone replacement therapy? What if I take my pill every day? Will that still happen?
You will still get the changes. Obviously, hormone replacement therapy that you can either do like transdermal, so like the gel or the patch, or you take it through pill form, like systemic. That can help a little bit of the vaginal atrophy that we call, or menopause. What is it?
Atrophy.
Syndrome genital de menopause.
Yes.
Forget what it's in English. Menopause. Well, anyways.
Genitourinary symptoms of menopause.
It can actually help a little bit with like getting more lubrication, thicker vaginal mucosa or vulvar tissue. But about 40% and maybe a little bit more won't be. It won't be sufficient to actually treat the vaginal part of the symptoms.
That's a lot. And a lot of people don't know that.
Exactly. So then you need that vaginal treatment, which can be either like a cream or a little pill or a little ring that we put inside.
Directly inside.
Inside to treat the vaginal wall and the vaginal mucosa.
Okay, so I should not be discouraged if I'm taking my pill or my patch regularly and I still have symptoms down there. There's hope.
There is still hope.
There's something we can do.
And if the major symptom is just for the vagina and the vulva, then we just treat that. So
exactly.
we do local therapy and not systemic
Now,
therapy.
if you don't have hot flashes, you don't need the systemic.
How can we take care of our body properly? So the side effect related to menopause.
So if you don't use it, you lose it.
She said it. It's true. It's exercise. It's just like any other exercise, right?
So again, I say it as a joke, but it is actually like it can help, obviously, because it'll get more blood supply, lubrication will stay, the mucosa will stay thicker and healthier with intercourse, but it doesn't have to be like with a partner. You can also use yourself.
Absolutely. You're always your best partner.
Exactly. And like dilators or vibrators, like anything that can actually help. Mm-hmm. Well, again, obviously just lifestyle, just having a good diet, staying hydrated, exercise 150 minutes per week. Those are just all the healthy habits that everybody should have.
There's a lot of benefits from just the simple things.
And then when you talk about hormonal replacement therapy, as we had mentioned before, like if it's just for vaginal or vulvar symptoms, then we're just going to go and target that with vaginal estrogen that we can use.
But if your problems are more like the hot flashes and the mood swings, then yeah, definitely start with your nutrition, exercise, good sleep, less stress, and you can add on to reduce your caffeine intake, chocolate, pop, reduce your consumption of hot drinks right before you go to bed, for example, or you'll get to know your triggers and just avoid those as much as possible.
Wine.
Alcohol is a bad one. Yeah, it's definitely hot flash inducing. Then you have your bone health, so regular weight-bearing exercises, weights, and calcium, vitamin D. Especially in Canada, we need our vitamin D almost all year long, so that's prevention for osteoporosis. Just generally through aging, your metabolism does slow down, so it's not necessarily that it will cause a weight gain, but if you have your same activity level and you have your same food intake with your metabolism going down with aging, that can create a weight gain. What happens specifically with menopause and the hormone changes of menopause is that your weight gain will be distributed unevenly or not at the same places that it will be distributed in your youth. So you will feel like you're gaining all your weight around the middle. That can be part of hormonal change, but the weight gain itself is probably more related to your metabolism and your habits.
Because the hormonal replacement therapy will not help that distribution.
It won't cure.
And it won't help with the weight loss.
Yeah.
What are they going to help with?
So, hormonal replacement therapy. So the number one reason why to use hormonal replacement therapy is technically for the hot flashes. So vasomotor symptoms. So basically like getting really hot, flushed, and that sweat daily or nightly, like that is what the hormonal replacement therapy technically is targeted for. Menopausal symptoms, like it includes a lot more than just night sweats or hot flashes.
Insomnia, mood swings,
difficulty sleeping, like you said, irritability, mood swings, a little bit of anxiety or depression. And again, those are all multifactorial, so it's hard to say if it's purely the menopause or if it's actually like
the environment,
the
habits,
your partner, your job, like just what's going on in your life at that time. Just general fatigue, lack of energy, just generalized pain, joint pain. That's a common one. So it is much more than hot flashes. And hormonal replacement therapy, if those symptoms are due to menopause, it will help. So then their mood kind of gets better, irritability gets better, their sleep gets better, the less pain in their joints, and then technically they could go and be more active. So I agree, like technically we don't necessarily need to just target the hot flashes for when we're talking hormonal replacement therapy. But if all those symptoms, which can be caused by so much more than just menopause, if there are help with the hormone therapy, then we know that that's what it's for. Like, you know,
at
that
least partly responsible
for.
Yeah. Where does libido come into all of that?
And again, libido is a very tricky one. I think we had discussed libido on a previous talk, but it is a very tricky one. It is so hard. Hormonal replacement therapy can maybe help, but not.
Yeah. If it's a standalone symptom and everything else is perfect, it's not likely that hormonal replacement therapy will cure your low libido. If your low libido is due to you having 25 hot flashes during the night and never sleeping, and you being very irritable and snapping at everyone around you, including your partner, and that you are extremely dry and sex is painful, it's understandable that you'll have a low libido, and it's directly related to your menopause. So then the hormones can help. So it's, like you said, a tricky question, and evaluating that, going through all of your history could be beneficial. Well, now that we've answered a lot of questions, I want to know what is left unanswered. I want to know from the audience if you still have questions, specific questions or more broad questions that we could possibly answer on a future
very interesting
talk.
So send your questions in.
Don't be afraid, it'll be anonymous when we answer them, and it's extremely confidential. Whatever you send into Sparkle is extremely confidential.
Except Madeleine will share examples.
Yes, Madeleine shares her own examples, so you don't have to be shy.
I get you back. Okay, thank you. Bye.
Bye. Have a good night.